Hi, welcome everyone. We're excited to have people joining us today for our Ask an Expert session. We're going to be getting started here in a few moments. I do invite, as you join, to open up the chat feature to say hello, which agency you're joining from, maybe where you're joining from. And we also will have an opening poll that you should be seeing up on your screen at the moment. And we invite you to select your answers there as well. So we'll get started here in another few minutes. Thanks, everyone. Okay, we'll go ahead and get started here today. I see we have quite a few folks joining us by looking at that participant list count. Keep going up. Let me first start by introducing myself. My name is Lauren Smiley, and I'm with the Human Trafficking Capacity Building Center, or referred to the center as short. The center is a coaching and development hub assisting organizations and tribes with starting, sustaining, or growing their anti-trafficking work. The center sponsors the Ask an Expert series, which is what you're joining here today. And the series is really aimed at convening skilled practitioners with the registered participants to discuss topics related to human trafficking. You can find video links to our other Ask an Expert webinars located on the center's website, which we'll be dropping a link to in the chat feature as well. But we're really excited to have you with us here today. Throughout today's session, we invite you to use the chat feature to communicate with one another, with me, with the moderator, and also our panel of experts that we have convened today. So if you haven't done so already, you can go ahead and open up that chat feature at the bottom of your screen to tell us where you're from and say hello to everyone joining us here. We're going to be closing the poll soon, but also just want to invite you to answer the poll questions as well. Today's session is being recorded. You may submit a question at any time during the discussion through the Q&A feature, which you'll see at the bottom of your screen. And there's also a nice visual there on the slide as well about where you can find that in your toolbar at the bottom of your screen. Questions will be answered towards the end of our time here today. And as I mentioned, our format today is a panel discussion followed by an open Q&A with everyone that's joining us here today. And we'll be discussing human trafficking and vulnerable populations as our topic for our discussion today. Following this webinar, the center will email you handouts as well as a full Q&A document with the information that's being shared today and through our panelists during the discussion. And you'll also receive a link to the full recording as well. But before I turn it over to the panel, I just again want to invite you to answer the poll questions if you haven't done so already, and use that chat feature to say hello and where you're joining us from today. So now I am pleased to turn the time over to Christina Rose. Chris is the director of the Office for Victims of Crime at the U.S. Department of Justice. Director Rose, over to you.
Thank you so much. Can everyone hear me okay? Lauren, maybe you can give me a thumbs up.
Just fine.
Perfect. Thank you so much for asking me to come say a few words at the beginning of this Ask an Expert webinar. I love the concept of Ask an Expert and being able to give people an opportunity to just ask lots and lots of questions. I want to thank the folks at the center, as well as Kristen Weschler from the OVC staff. Everyone has worked so hard to make sure that this webinar happens today. As some of you may know, I was sworn in as director of OVC in July. And even though I'm new to the role, I used to work at OVC and served as a deputy director. And at that time, I oversaw all the human trafficking work. So that makes this opportunity to speak to all of you that much nicer. Over the course of my career, and I've been working in this field for quite a long time, I've really tried to focus on ways to expand access to victim services and increase the opportunities for victims and survivors to be able to make their own choices, as well as make their own determination of what justice means to them. I'm very passionate about these things, and because they are all part of OVC's mission, I couldn't be prouder to be in this role. I mean, this is a dream job for me. And as the largest federal funder of services for human trafficking victims in the US, our goal is to make sure that all trafficking victims do have access to both victim-centered and trauma-informed services. So many human trafficking victims don't even realize sometimes that they fall into that category of victim, or they may not think of themselves that way. So making sure that we can ensure that all trafficking victims, regardless of what their immigration status, gender, the form of trafficking, that they are all able to access the services that they need. And, you know, in speaking about victims of human trafficking who don't seek help because either they don't know that services are available or they just don't see themselves as victims, this is why people like all of you are so important, because you're the ones who are in the perfect position to be able to identify these individuals and make sure that they're getting these services and have access to them. So thank you to all of you for that work that you do. Today's conversation is going to focus very much on how to identify and support victims of human trafficking, but also how to remove those barriers for accessing services and how to develop outreach strategies to reach some of the most vulnerable populations. And while there's no single profile of a trafficking victim, our grantee data that we get from all of the folks that we've given funding to, as well as from people that we have heard from the field and from survivors themselves, that human trafficking disproportionately impacts Black and Brown communities. And we know that this is due in part to the inequities in our system, historical oppression, discrimination, lack of economic opportunities, and the systemic racism that is so evident in our system. OVC's human trafficking grantees reported that from July 2015 to June 2020, that 29% of clients served through OVC funding were Hispanic and Latino, and 23% were Black and African American. And that is way above the Census Bureau's figures for those populations during that period. And for all we know, and really we do know, that those figures are probably much greater because we know there are so many victims out there that are not getting services and never seek help at all. There are many other populations that are at risk for human trafficking, including those that are living in impoverished and rural communities, runaway and homeless youth, the LGBTQ community, and the Indigenous communities. And this webinar is really meant to give you the tools, the advice, the guidance that you need to be able to serve them better. So we can all empower survivors in their own healing by honoring their unique experiences and by ensuring that they have agency and they have choice in their interactions, whether it's with law enforcement, service providers, health professionals, criminal justice professionals. And I know that all of you are working so hard to deliver these services, especially during these challenging times. And I know you're all trying to balance so many other things, like kids finally going back to school. I can't imagine how, you moms with young kids are doing it, and you're still finding the time to come to a webinar like this and continue learning. My hat is off to you, and so grateful that you are participating in this webinar. So I'm glad I had the chance to say hello, and I'm looking forward to the discussion. I'd like to turn it over now to our moderator, Gonzalo Martinez de Vedia. Gonzalo is a published author and expert on the topic of labor trafficking. He is also a member of the Field Advisory Committee for the Human Trafficking Capacity Building Center, the Center. So Gonzalo, over to you.
Thank you, Director Rose, for that introduction. When I started at as an OVC grantee 10, 12 years ago, really my first full-time job, the training we had at the orientation was that trafficking could affect anyone. And a trafficker could be anyone, which is strictly true, of course, but the 201 version that I got to learn out in the field and that so many of us have experienced and contributed to by reporting our time into the databases and our cases into the databases is that some communities really are disproportionately affected. And we have enough evidence about that now to adjust our programs to make them that much more tailored to those additionally vulnerable populations. And we have an incredible panel to dive into that topic today. So let's get started. Joining me today are three panelists, Ayana Wallace, Marilyn Lovo, and Samantha Samuel Naka. Ayana is with UJIMA, which is the National Center on Violence Against Women in the Black Community, a project of the DC Coalition Against Domestic Violence. She has extensively studied the theory and implications of privilege, oppression, and intersectionality, and strives to highlight the experiences of demarginalized and underrepresented. Welcome, Ayana.
Thank you. Glad to be here. Looking forward to this.
Marilyn is the language access manager at Ayuda. In this role, she trains, interprets, educates, provides services, and arranges interpretation and translation for 80 nonprofit organizations throughout the DC metropolitan area, ensuring victim services nonprofits can serve all clients regardless of the languages they use to communicate. Welcome, Marilyn.
Thank you so much. Pleasure to be here.
And last but not least, Sam is an expert in the field of human rights with a focus on gender-based violence and human trafficking. Sam is currently serving as project specialist for the Human Trafficking Capacity Building Center, where she advises victim service providers on how to start, sustain, or grow their anti-trafficking work. Welcome, Sam.
Thank you. Hi, everyone.
And as a reminder, as we dive in here, please submit your questions through the Q&A function at the bottom of the screen. So let's get the discussion started. Sam, I'll start with you for the first question. Like we were just talking about, vulnerable populations don't fit into one simple category for services. How can a small organization be effective in supporting such a broad spectrum of needs?
That's such a good question, mostly because there's no one-size-fits-all approach to serving human trafficking survivors. So I think being effective in supporting survivors will look different in distinct contexts, given how diverse the communities are that it affects. I think for starters, there's three things that small organizations can do to support a broad spectrum of needs. First, organizations can build their internal awareness around the ways that trafficking survivors that they may be serving also have intersections and may overlap with other forms of vulnerability, like intimate partner violence, substance abuse, poverty, and other issue areas like homelessness and immigration status. So understanding those intersections will really allow you to understand the additional barriers that survivors might have in accessing services. Two, organizations can assess their internal capacity. So really thinking through, what can our organization offer human trafficking survivors and what limitations do we face? A part of assessing your internal capacity is identifying gaps and really thinking through, who aren't we serving, and are we able to offer comparable services to distinct populations like male survivors, survivors with disabilities, survivors with limited English proficiency. And if we can't, then thinking through who can. And as you're assessing your internal capacity and you find that you can offer high quality comparable services, then great. It might be time to do some outreach to those underserved populations so that they're aware of your services. But at the same time, if in your internal capacity review, you see that you can't offer comparable services to specific vulnerable populations, that's also really great data to know, because then it's time to think through, what partners can you connect to who can? And then lastly, I think it's important to consider your community. So if while you're mapping out your internal capacity and you see the demographics of your current clients are not reflective of vulnerable populations in your community, I would think through, what barriers exist that are preventing them from accessing services. Is it language? Is it accessibility? And then thinking through, what partners are really locally rooted in those communities that we can bring on to create a more coordinated response. And the last thing that I'll say, because I know that I'm throwing a lot out there, is that in order to meet a really broad spectrum of needs, no matter what size your organization is, I think it's so important to be culturally responsive in your approach and adapt your services to meet the needs of vulnerable populations across different cultures, whether that's in-house or through partners. And for me, a large part of that is employing cultural humility in knowing that populations are not homogenous. So even within communities, there's a diverse set of needs. And so when we're thinking about how best to serve, positioning that framework as being an ever-learning process that will require you to be reflexive and adaptive as you learn.
Thank you. So that's a lot of ground, and we'll dive deeper into that in the questions. But I want to just go on one of those points about the barriers that you mentioned. Maybe Marilyn, I'll turn to you for this one. What are some of the common barriers that survivors of human trafficking face when accessing services?
So victims of crime face a lot of barriers, and human trafficking victims also face a lot of barriers when trying to access services. And one of those barriers is the language barrier. When a limited English proficient individual or a deaf individual becomes a victim of crime, that individual needs language support through the entire recovery process in order to be able to succeed and thrive. And that recovery process might include services such as crisis intervention, case management, counseling, transitional housing, and advocacy. And in order for these services to be effective, victims must be able to access them in their own language. In Washington, D.C. alone, roughly 5% of the population is limited English proficient. And in Maryland, about 7% of the population is limited English proficient. DC also happens to be one of the largest per capita populations of deaf and hard of hearing people in the United States, many of whom communicate using American Sign Language. And frequently, the reason why victims of crime don't come forward or don't request assistance from victim services organizations is out of fear that the services won't be available in their own language. Part of that could be the fact that when they walk in through the door, they don't see anyone that speaks their language, or a lot of the signage or the material is in English and not in their own languages. There are many ways that victim service providers can make their services accessible, and I just quickly wanted to share 3 ways. The first one is creating a budget line item, a line item in your budget to pay for interpretation and translation services. One of the questions that our program receives often is, how much money should our program or our organization set aside for interpretation and translation? You might be able to look at census data to see what is the LEP or deaf population in your area. Your organization might already collect information about your clients and the languages that they use to communicate. And you can use that data in conjunction with other research that you can do. You can look at your area and see if there are agencies in your area that provide these services. You can ask how much they charge per hour or per document if we're talking about document translations. And using all of this data, you can come up with an estimate. And then as the year goes by, you can adjust your budget depending on the LEP population that comes to your organization. The other way that you can make your services accessible to victims of crime is to establish relationships with agencies in your area. At least in DC and in Maryland, several nonprofits have access to Ayuda's interpreter banks. And so they can come to us and we train, we vet, we train, we recruit interpreters so that those interpreters can interpret for nonprofit staff and their clients. But there are agencies all over the nation that provide similar services, and it would be great to establish a relationship with them. And then the last thing that you can do is you can create a language access plan for your organization so that your staff has clear instructions on what to do when an LEP individual comes walking in through the door. You can also come up with a plan in the case that you can't find an interpreter or you can't translate a document. Perhaps there's another agency that you can go to, or there's a volunteer that is willing to volunteer their time and provide those services. Or maybe in your organization, you have the budget to hire a more bilingual staff so that you can meet that gap. But in summary, just to quickly summarize, because I know I threw a lot of information at you there. I think the three key takeaways are: create a line item for your budget for language access, establish relationships with agencies in your area, and then create a language access plan.
Yeah, it's such an important plan to go beyond just talking about language access, talking about cultural competency. If we've not waited until that 2 a.m. call to figure out who our interpreter will be in much better shape. And then even beyond that, I always like to, if I can, give a shout out to all the development people that work within our agencies, because they are the ones who think a year in advance and have put in, like you said, that budget item to actually cover the time of professionals who do this work. So crucial. So let's shift tracks a little bit now. We've thought about our resources within our agencies. Let's think back out to the community now that we serve the topic here, our vulnerable populations. Ayana, I'll turn over to you for this one. Let's start from the beginning here. What is it that makes one individual, for example, more vulnerable than another one to human trafficking?
Yeah, I think that's a good question, especially when we think about the image of trafficking survivors and who's left out of the conversation. This could be, honestly, for me, a very long-winded answer, but I'm going to try to narrow it down a little bit. But so I would say that, yes, people make individual choices largely for survival that can lead them into dangerous situations. But I think it's actually much more important to really think about and talk about all of the other context that leads to that, or all of the other systemic barriers or social barriers or influences that actually put someone in a dangerous situation or set up the structure in which allows for violence to happen to certain communities at higher rates than others. So for instance, when folks talk about young Black girls being trafficked, for example, folks tend to really point the blame on supposed negligence of Black parents. They really latch onto the lack of supports, lack of supervision as being the cause of trafficking for Black girls, and presume that Black parents are, again, just negligent or not present, instead of really focusing in on what are the systemic barriers that have set up parents to not be able to be home with their children, to have to work multiple jobs, to have to work very, very long hours. What's happened where there might only be one parent in the home, whether it's because of community violence or mass incarceration or many other things. Like, what are all these other influences that are creating this gap. And then not only to focus in on that gap, but to really, again, focus in on, okay, what's happening to Black trans youth and housing and homelessness and family violence? What's happening to young Black girls who are being pushed out of school because they're being adultified, or because, you know, the school to prison pipeline is impacting them and they're finding themselves out on the street, or they're finding themselves with community members that know that, you know, adults, you know, think of Black girls in the following ways. And so they know that Black girls aren't viewed as vulnerable, or aren't viewed as childlike. And so they take advantage that way. We're not talking about the fact that colorism, or really, like, there's so many different things that I'm thinking about that could impact Black girls being seen as someone to be preyed upon. I was having a conversation with my director, and we were talking about trafficking generally. And she was telling me how, I think it was something she read or a documentary, where a trafficker, a Black man was a trafficker. He was acknowledging, yes, we have so much access. We might be the ones trafficking, but overwhelmingly still, the buyers of sex are white men, or of people that are not Black. So thinking about stigma, thinking about exotification, thinking about all these different layers comes up. They also went on to talk about how you will make more money if you traffic white women, but you're gonna get less time if you traffic a Black girl, right? So again, understanding the different layers of violence that a Black girl or Black woman might experience generally, and then thinking about how then does it tie into intimate partner violence, or domestic violence, or sexual assault, or trafficking. And so I'll stop there because I could go on, but I'm gonna stop and turn it back over to you, Gonzalo.
Such an important topic, and so many people responding here in the comments. Let's keep that discussion going. Make your comment into a question, and then we'll follow up with Diana here. But for the meantime, I'll go with what we have while my dog decided to have a conversation here across the street. So hopefully you can all hear me through that. This one, I think it will be from Maryland, but anyone feel free to jump in. I like to think I've learned everything the hard way, and I've been in this situation where I brought in an interpreter, especially in the rural areas. This is, you know, a challenge, where the interpreter walks in and we have maybe someone we are representing and a federal agent there to interview them. And the interpreter says, oh, I know you from, you know, so-and-so place. Maybe they have a little small talk. Maybe they're breaking the ice, but you know, bringing information and dynamics into the conversation that maybe shouldn't have been there. So here's the question from Kyla. If language services are not available, is there any reason we should not use family members or friends of the victim to provide interpretation?
Excellent question. I love this question because it's one that we get very, very often. And I'll preface it by saying that not all bilingual individuals are interpreters. Interpretation is a very specific skill, especially if you're talking about, for example, bringing someone in to interpret between an attorney and their client, or bringing someone in to interpret between a therapist and their client. It requires not just the basic skills of interpretation, but then also that extra level of training, so that you know about client-attorney privilege, you know how to maintain confidentiality, you know how to provide trauma-informed interpretation. And so that's why we always say that not all bilingual individuals are interpreters, because it's a skill that requires training. Another reason why we strongly recommend against the use of volunteers, of family members, of friends, of children, it's because, you know, we don't know what the person's intentions are with your client. I mean, we've read cases in which a client's abuser is interpreting for the victim of crime, and you know, you can assume that that interpretation is not unbiased. And so that's another reason why we strongly, you know, recommend not using family or friends, also because you don't want to place that person in that uncomfortable position, you know. And so I do understand that for some languages and in some areas, it's extremely difficult to find a qualified, trained interpreter. The silver lining about the pandemic, I think, is that a lot of these services are now available remotely. So even if you don't necessarily, even if your organization isn't in DC, but there's an agency in DC that has access to interpreters, you can contact them and see if they'd be willing to offer their services at least remotely, right? There are many national telephonic interpretation agencies that are available. Obviously, the training of those telephonic interpreters can vary, but you have that as an option as well, where you're at least getting someone who has the basic training of an interpreter. And if possible, I don't know if like it's within your organization's budget, but if there's anything that you can do to try to hire more bilingual staff who can provide services in language, the one thing that you would have to make sure is that they are proficient in their languages, so that, you know, they aren't having to play the role of interpreter and service provider, that they can just offer the services in language. So whenever possible, we always strongly recommend a specially trained interpreter, preferably in person if you can, but obviously because of the pandemic, like over the phone or over the video, whenever possible.
Thanks so much. So we'll stay along this track. The other side of that coin, language access, is also cultural competency. We have one question from Betty here about how we can gain or acquire cultural competency within our judicial system. And there she means the broader network of law enforcement, solicitors, judges, criminal investigative lawyers, and advocacy centers. Could anyone share anything about working with partners on that part of their work?
I can jump in. So I think it's really especially important to make some partnerships and make really solid partnerships when you're doing this work. I know that when I was training law enforcement, for instance, and we would do any type of DV training or human trafficking training, even just to give them like 15, 20 minutes of solid information or like clues to look for or things to ask or ways to be trauma informed, we would like show up to their roll calls and give them 15, 20 minutes before they went out on the streets. We've done it where, and not everybody's comfortable doing it, but we've done it where we, in my previous work, we've done it where we would go out on ride-alongs with police officers, for instance, just to be able to sit and observe or even give feedback. We've connected with hospital-based programs to let them know what's going on. Again, really at any point you can engage folks. I think it's always great to just hold conversation. If anytime you can bring in outside speakers, sometimes that's a great way to just get folks excited about the conversation. But just setting intentional space for it and time to do it, and making sure folks understand when you do preemptive work like this, you then don't have to scramble to try to find the interpreter at 2 a.m. or try to find these extra resources because you have no other options or you don't really know where to look. So I'll add that and I'll open it to anybody else.
If no one wants to jump in more on that one, I'll just reiterate, how important this key point is here, that it's not a change that's going to come about overnight, right? That in that example, showing up, going on ride-alongs, whatever that might mean for your partnership with that law enforcement or service provider that you work with, building that capacity over time within the staff that's been there for a long time, that's going to stay there with the cases. That's the longer term work that might not happen over just one grant cycle, but it'll definitely pay off in the longer run. It's probably true across the board of all the topics that we are discussing here. Someone here in the questions wanted to know specifically about adapting to the needs of victims with various types of disabilities. Would anyone on the group be able to jump in on that?
I can speak briefly about the deaf community. And let me just preface it by saying that, there's capital D deaf, which, you know, is a term that corresponds with the cultural aspect of being part of the deaf community and having that shared language. And then there's the lowercase d, which has to do with loss of hearing. But one of the ways, you know, our program trains organizations on how to properly serve the deaf community, because oftentimes people assume that because you're deaf, you automatically communicate using American Sign Language, and that's not always the case. And sometimes a deaf individual might also be blind. And so, you know, we do some level of orientation on how to serve deaf individuals, deaf blind individuals. And you know, we always say have access to, at the very least, a video remote interpretation service so that you can connect to an interpreter and ask some initial questions, such as, what is your preferred method of communication? Is American Sign Language your first language, like the primary way that you communicate? Or do you communicate in other forms of sign language? Were you born deaf, or did you become deaf later in life? Have you ever been a victim of a crime? Are you a minor? And the reason why we ask all of these supplemental questions is to determine how to staff the assignment, whether it would require just one hearing American Sign Language interpreter, or what's also referred to as a certified deaf interpreter, which is an interpreter that is deaf, but has gone through a lot of training to be able to bridge gaps in interpretation, using different gestures or different signs, or sometimes what's known as tactile interpretation, where there is some level of touching if the client is blind, and they need to communicate that way. So to kind of like wrap up this answer, I think when serving anyone with any sort of with anything that might prevent them from effectively communicating, I think the important thing is to just ask them questions and meet them where they are and try to accommodate as best as you can.
Thank you. Anyone else on that topic? We have a 10-second question for a 10-second answer. What does the acronym OVC mean?
Office for Victims of Crime.
Thank you, Sam. I could have answered it myself, but then, you know, that's not fair. I'm just the moderator. I didn't want to get it wrong, but I was quite sure it was OVC, yeah. Office of Victims of Crime, great. So we have a big audience today, and, you know, I'm sure we have some agencies here that have decades of experience and are really getting specific on really unique and specific topics, and others that are just getting started. So I want to grab one question from the, I'll call it the 101 box. Going back to the basics, we've talked about how our agencies, each agency can do a lot to build its own capacity, but you know, when that has its limit, maybe a question for Sam or anyone else on the panel, how can partnerships help us better serve and reach victims of human trafficking?
Yeah, I can take a first poke at that. Partnerships are so essential, because the reality is that no one organization can do it all, and this work does intersect across like geographic boundaries and issue areas, specifically when we're talking about vulnerable populations, and we can't do that work alone. So, you know, I was thinking as Ayana was talking about how important that relationship building is, and the time that it takes to do that, and it was just like yes to everything that you were saying, as a side note. But yeah, so in building partnerships, I think, you know, really cultivating those relationships with allied fields and organizations in your community is really important, especially because it allows service providers to offer survivors a really wide range of services. So it expands the amount of services that you can offer a survivor, and offers choice to whether a survivor, you know, has the opportunity to take you up on those services. I think one of the things that's really important when you're thinking through partnerships is that they can look really different. It can be small, informal, formal from your local community, across regional boundaries as well. And I think something that's really important to think about is really thinking outside of the box when you're considering partnerships, and looking at survivor services more from a continuum of care perspective. So really looking at like What does a survivor need from direct crisis intervention to those long-term supportive services? And what partners can you bring in that will allow you to provide survivors with a really diverse range of services? You know, really just honing in on the fact that safely leaving your trafficking situation is just the beginning, and those healing and supportive services are really long-term and lifelong. So what are the services that we can bring in at those different points that can be supportive to a survivor? And yeah, I think also just, you know, partnering with community-based organizations and culturally specific organizations, survivor-led organizations to help you think through what some of those needs are really important partners to have as well.
Thank you. I'll take another quick one from the 101 category here, going back to the basics. This question is about family members who notice that something might be going on, maybe picking up on some indicators of human trafficking. The question is if there is a central number that a family member would call. I guess the way I would rephrase that question, if they'll let me here, is would a family member call a different number than anyone else who is concerned? Would that process look any different? And then the second part of the question is what signs would a family member look for if they're concerned about human trafficking from someone in their family? Sam, you're welcome to keep going on this one, or anyone else can jump in.
I don't have the extensive answer. I'm sure folks can add, but I would say just from my experience on Hotline, and I don't have the central line, I would say some resources, depending on your state, might be easier to access than others. And it's always helpful to connect with the domestic violence or sexual violence coalitions as well in your states. But from my experience working in Hotline, the initial information gathering, initial intake process is going to be more or less the same. They're just trying to get as much information as they can, but they'll still need to talk to the survivor to see if the survivor even wants to engage with them or with services at all. So I would say if you connect to any program or any type of program, whether it's DV, SA, or specifically trafficking, to try to get some resources from them that you could then share first, or at least to pass on the information, because a lot of times they'll need to speak to the survivor regardless of however much information you tell them.
Speaking of resources, I'll throw another question in here from the chat. What are the local and national resources that have deeper expertise on this topic of vulnerable populations? And before I turn it to the answers here, the first one, of course, is the Capacity Building Center, which is hosting us today, which has tons of good resources. And I wanted to point out that Lauren was putting at least one link there in the chat that I saw go through. So definitely start with what's already out there at a national level. People have put a good amount of work into what we have by way of general resources, but there's a lot more than that. And I love the part of the question that you're asking also about the local resources, right? Sometimes local NGO can really know their local community and their vulnerable populations in a way that no one else really would be able to from afar. So any thoughts on that from the panel? Resources, next website to visit on this?
I can jump in briefly just because I always take advantage of any opportunity to elevate language access. At least in Maryland and in DC, the nonprofits in the area have access to our interpreter banks. We are a shared centralized resource. And so if a human trafficking victim comes in through the door and they're LEP or they're deaf, these organizations can come to us and we will help arrange interpretation either in person, on site at a physical location, or remotely over the phone through a video conferencing platform. We also arrange for what we call on-demand telephonic interpretation, which we contract with a third-party agency so that these organizations, all they have to do is pick up the phone and dial a number, and they can be connected to a telephonic interpreter within a couple of seconds, sometimes a minute if it's a language that of lesser diffusion. And then we also have partnerships with other translation agencies in the area, and we arrange for the translation of several documents. So if you're a nonprofit staff person in Maryland or in DC, you can feel free to contact the UDA, and we'd be happy to make your services accessible to any of your clients, including victims of human trafficking.
All right, I'm taking one live from the chat, even though there is a Q&A function. So I gave priority to everyone who found that button. We do see some questions coming in the chat here, and this one's really important. How does someone get started providing these services? And they're saying here, I've had trouble identifying locations that even provide services since the pandemic. Many locations have closed. Are there any resources that can identify areas of human trafficking within states so that the services can be provided where they are needed?
I'm going to put a plug in for the center. So helping start, and thinking through how to start that process wherever you are in your anti-trafficking service provision is something that the center can definitely support with. And I'd encourage you, I'm sure I see Lauren in the chat. And I'm sure that our contact email will pop up at some point, but talking about the specific needs of your local community and what that looks like for you, and helping you think through some of those key considerations, I would definitely encourage folks to contact the center in starting this anti-trafficking work or growing it.
Beyond the national resources, if we could maybe, as we get towards the end of the call here, I know we've thrown a lot out there, but I always think that question's really important and logical for a group that wants to start moving in a certain direction. The first question in that comment was, what are the first steps, right? So we've looked at the national resources. If you are that NGO that's just getting started, what would you all recommend on the panel as, not necessarily the required first step, but one first step you can take towards better accessibility for vulnerable populations to our services? You can do a speed round here. If everyone wants to throw in one idea, please.
I think I can get it started. I think connecting to organizations, whether that's through your local task force or local DV center or shelter to see what anti-trafficking services are being provided, and then coordinate your response that way is an important way to coordinate services and not duplicate them, so that we're building a stronger coordinated response and seeing really where the needs are. And typically domestic violence shelters in a previous past life that I was in do see a lot of trafficking survivors, even if they're not self-identifying that way, and are providing services. So seeing what work is being done on the ground, maybe through them and other providers that you can help expand and enhance, I think is a starting point as well.
Thank you.
To jump off of Sam's answer, I think another step, once you have figured out what services are available in your area, start doing outreach, right? And also making sure that your outreach materials are translated into languages other than English, that your office forms are translated, that your website, if you can't translate your entire website, that at least the pages that have the most traffic, that those are translated. And so that's another step that you can take just when you are conducting outreach, making sure that you're outreaching to the limited English proficient community in addition to the English speaking.
I'll go on a little side tangent here right before we finish, because you had a question come in as you were saying that, Marilyn, from Jonathan from a legal aid, asking for more of a definition of outreach, because he's heard the term being used to describe different kinds of activities. And he put a little list in there, using art, handing out flyers. Interested to hear your definition of outreach.
Yeah, so outreach, I mean, a lot of the times, some outreach happens through word of mouth. Like someone goes to the organization, they get served in their own language, and then they go back to their communities and say, hey, go to that organization because when I went there, they found me an interpreter and I was able to ask my questions and I was able to get the services that I needed. And so outreach is going to happen through word of mouth. It can also happen through written materials, right? So flyers. It could happen through website content or social media, right? All of your posts, if they're being translated into multiple languages, you'll be able to outreach to multiple communities in that way. And yeah, I mean, outreach is just basically how do we get the word out? How do we make sure folks know that we're here and we're ready to help?
And I'll add on that, I think also making sure, like, yes, getting information, translated information, easily readable, accessible information out there, but also making sure to show up in community. Like, don't just show up and hand out a flyer and think that's good enough. Like, you have to show up and be in community with people, whether it's eating food, whether it's being informal, walking up and down the street, sitting at the park, like wherever folks are, like you need, making relationships or building relationships with community elders. Like there are so many different ways to be in community, but you have to really show face and show up as like, we're not just this org coming in because we want to check off our boxes. We really actually care about you and invest and are invested in what you have to say to us or say back to us.
Yes. So for anyone taking notes today, that means we will not use our outreach budgets just to put up billboards and flyers, even though that's important. And even though it's made such a big difference in so many cases where people have called the number because they've seen an ad. I certainly was trained that way, that, it sometimes takes an average of 4 interactions to really build that relationship to the level that we might actually get to discuss what might be going on in someone's life. So for those of you that have the luxury of having that amount of staff time to be out in the community, especially now that in-person outreach is beginning to make a comeback after so many outreach programs were offline, or rather online, right? And having to only advertise on social media and such, it'll be a big year coming up for in-person outreach. So let's get back to that. I will try to pick up just 1 or 2 final questions. If anyone has thought of anything during the Q&A, please try to get them in now before we run out of time. We had a question here about data sources. So, and I noticed during the opening, we heard some statistics and right away people were wanting to hear them again and see the source. So that's great. As always, I think everyone is hungry for better data, better numbers to put behind what we already know and what we've learned through experience. Where are we going? For anyone on this panel, where are you all going for reputable, reliable information on human trafficking trends in your community, especially if they relate to vulnerable populations?
So we at Ujima have a research and evaluation work group. So they do a lot of our writing, a lot of our fact sheets, like I just dropped one into the chat. And so we are constantly just updating resources, but we're also gathering a lot of stories and anecdotal experiences, which we think is equally important, or maybe even more so important than simply talking about data.
Anyone else on data sources?
I know that the Language Access Program at AUTHA uses a lot of census data. And also because of how tight-knit the victim services community is in DC. I mean, a lot of the organizations that we work with, they put out yearly reports on crime statistics, on a variety of different data points, and they also collect client stories. And so we're able to gather some of our data through some of our nonprofit partners. And then I think stories are very important, especially if you are looking to apply for funding to serve a specific population. And in order to be able to demonstrate the need, I think the strongest data point is probably those client stories, because those are the ones that really show the most impact.
Yeah, and within the agencies that keep strong internal records, nothing like going back to the file and just seeing what what you all have learned within your four walls over the year. Even if, for so many reasons that data never goes, public or becomes published for good reasons, we can at least use it for internal training and to better orient our programs. Okay, so we've hit on all the themes here: identifying first the vulnerable populations that we've talked about, developing outreach strategies in all the ways that we just discussed, and of course then removing barriers for vulnerable populations to access services. I think we have just maybe 2 more minutes before we start to wrap up for everyone on the panel to share one key takeaway that they would want. If anyone had just tuned in now and wanted to hear the most important message that you shared with us this afternoon, what would it be? And yeah, maybe Ayana, we'll start with you.
Yeah, I'll start. I would say probably the one major takeaway that I would have is that regardless of however they were introduced to trafficking, they are deserving of help and deserving of respect as they receive services.
I can go next. I think it's very important to make our services accessible to all human trafficking victims, and that also includes victims that don't communicate in English primarily. And I think that the easiest way to prioritize language access is by creating that line item in your budget to be able to provide these services.
I think for me, it's that we can't do this work alone. So really finding and creating a strong community response to that, and thinking creatively about the ways that trafficking intersects with so many other issue areas and systemic oppressions, and how vulnerable populations overlap in all of these different systems, and thinking about how you can offer services in a way that supports their whole selves beyond just their trafficking situation as well.
And I'll just apologize to all the great questions that came in during this discussion that we didn't get to. We will see if there are any that we can get to in writing. But until then, I will thank Ayana, Marilyn, and Sam for sharing their thoughts today. It's been a great conversation. I hope our panelists have offered you some new insight for serving vulnerable populations within our human trafficking victim community population. We will be following up with each of you through email, attaching relevant resources, a Q&A summary document, and this discussion has been recorded as well. Before we close, please take a moment to respond to the poll that will be on the screen here. If you have questions about how to apply for federal funding or need assistance with your anti-trafficking work, and there's the poll. The Human Trafficking Capacity Building Center offers a variety of no-cost services to help organizations and tribes start, sustain, and grow their human trafficking services. The center's free coaching services include open office hours with topical experts, one-on-one coaching, and cohort sessions. Visit the center's website to learn more. And we'll just give you all 1 more minute here on the poll. So the link to subscribe to the OVC news is in the chat. We encourage you to subscribe so that you will receive notices about OVC's programs, initiatives, and funding opportunities. There are also links to Understanding Human Trafficking training series videos and a list of the OVC funded grantees and human trafficking task forces listed in the chat as well. We hope that you might be able to use those resources in your work and that you found today's session informative. I definitely did. We look forward to having you in the future as we keep going with this Ask an Expert webinar series. So thanks again to our panel. And if anyone hasn't gotten to the poll, there it is on the screen. That's all for me. Thank you.